Though we realize a great deal of information on COVID-19 is already available, the Dartmouth COVID-19 Response Team would like to take this opportunity to familiarize all of you with the following facts. Some of the symptoms may include cough, fever, shortness of breath. Emergency symptoms may also include trouble breathing, persistent pain or pressure in the chest, new confusion, bluish lips or face. We do encourage you to call 911 in the event that you experience any of these. Though everyone is susceptible, who is at greater risk? Adults aged 65 years or older, people with chronic underlying medical conditions, particularly those that are not well controlled, cancer treatment, smoking, bone marrow or organ transplant, immune deficiencies, poorly controlled HIV or AIDS, prolonged use of corticosteroids and other immune weakening medications, severe obesity, diabetes, chronic kidney disease, undergoing dialysis, liver disease. What happens if you do feel sick? Stay home. Most people with COVID-19 have mild illness and are able to recover at home without medical care. Do not leave your home, except to get medical care. Do not visit public areas. Avoid using public transportation, ride-sharing, or taxis. Call your primary care physician or local hospital if you do not have a primary care physician. Your doctor will advise you of how to manage symptoms and will decide if it is appropriate for you to get tested. What happens if you do test positive or a person in close contact with you tests positive? If a person tests positive, their doctor will upload his or her information to a secured state database, which then alerts Dartmouth's Board of Health of a positive case. Dartmouth's public health nurses will then follow up with that person to monitor symptoms and track self-isolation implementation. Dartmouth public health nurses will begin close contact tracing of the positive case, which includes those living with a person and anyone who has been in contact with the person for a period of 15 minutes or longer and within a 6-foot distance. Both criteria must be met. Those who meet this criteria will then be asked to self-quarantine. Due to HIPAA law, names, locations, and other personal information cannot be shared with the public about any confirmed or suspected cases of COVID-19. The Dartmouth Board of Health is continuously monitoring the situation in Dartmouth, Bristol County, the Commonwealth of Massachusetts, and will continue to inform the public with any new and pertinent information. Because medical terminology can sometimes be confusing, we wanted to explain the difference between self-isolation and self-quarantine. Self-isolation practices are for individuals who test positive for COVID-19. Self-quarantine practices are for individuals who are close contacts of individuals who test positive for COVID-19. What is self-isolation? Self-isolation includes separating yourself from the public as well as other people within your home. Specify a sick room and bathroom if possible in which only the sick person will use. Stay away from other people in your home. Avoid sharing personal household items. Do not share dishes, drinking glasses, cups, utensils, towels, or bedding with others. Wash all of these items thoroughly with soap and water or put in the dishwasher or washing machine. Wash your hands often with soap and water for at least 20 seconds. This is especially important after blowing your nose, coughing, or sneezing, going to the bathroom, and before eating or preparing food. Clean all high-touch surfaces in your isolation area every day. Let a caregiver clean and disinfect other areas of the home. High-touch surfaces include phones, remote controls, counters, tabletops, doorknobs, bathroom fixtures, toilets, keyboards, tablets, and bedside tables. Do not leave your home unless for necessary medical care related to COVID-19 symptoms. If you must leave your home, wear a face mask if available. The CDC notes that you may need to improvise a face mask by using a scarf or bandana. Restrict contact with pets and other animals while you are sick with COVID-19, just like you would around other people. Although there have not been reports of pets or other animals becoming sick with COVID-19, it is still recommended that people sick with COVID-19 limit contact with animals until more information is known about the new coronavirus. What is self-quarantine? Self-quarantine involves separating yourself from the public and remaining within your home. Do not leave your home unless for necessary medical care. You may continue to be with others within your household, but continue to practice good hygiene and cleaning practices. Wash your hands often with soap and water for at least 20 seconds. This is especially important after blowing your nose, coughing, or sneezing, going to the bathroom, and before eating or preparing food. When does self-isolation or quarantine end? Isolation or quarantine ends once a public health nurse has deemed it possible following strict CDC guidelines that are based on time and symptoms. With some of the biggest questions being how are Governor Baker's orders, home isolation, and social distancing guidelines being enforced in Dartmouth, it is important that you know that the COVID-19 Response Team has implemented multiple measures for increased compliance with these directives, including increased signage of social distancing guidelines at all public parks and trails, compliance checks and education visits with local businesses and public recreation areas, and continued monitoring of self-isolation and quarantine. As is always our recommendation, please continue to get your news and information from trusted sources, and remember that your safety is our greatest priority.